Hi, I'm Steve Hinkley. I'm the president and CEO of the Adventure Science Center, and I'm joined today by Dr. David Aronoff, who is the director of the Infectious Disease Division over at Vanderbilt University Medical Center. David, welcome back.
Thank you for having me back, Steve. Really appreciate it.
Yeah, good. So we had you here a few months ago, and we felt like we're in a good place. We had just, I think the third vaccine had been authorized for COVID, and it seemed like we were in a good position really to kind of get a hold of this thing and maybe get some control over COVID. And here we are about 4 months later, and we seem to maybe be moving in another direction. So help us understand what's going on and what's sort of the latest situation with COVID.
Right. Well, it wasn't that long ago, the end of 2020, early 2021, when disease activity was really high. We started rolling out vaccinations, and disease activity in our area, like in the rest of the country, really started to fall. A couple things have changed since that time. Probably the most important has been the arrival of a variant of the original SARS-CoV-2 virus, which we're now referring to as the Delta variant, but there have been several variants circulating that are much more contagious than the original SARS-CoV-2 virus. So it's making it easier for people to get COVID. And that has certainly played into more cases being diagnosed here recently. But the other is that we've slowed in our vaccine efforts. Early when vaccines were rolled out, they really ramped up. In fact, in the US, in April, we were vaccinating at a clip of about 4 million doses a day. But recently it dipped below 500,000 doses a day. We're creeping back up right now. So that combination of having about half the population still needing to get fully vaccinated, some not eligible yet, some of our youngest members of the population, and the rise of these variants have put us on our heels a bit, and things have been going the wrong direction.
Is the vaccination rate, and I think Tennessee is at about 39% fully vaccinated, is that a supply issue? Is there a challenge to get enough doses of the vaccine? Or is it that there's plenty of supply, there's just some hesitancy and resistance to being vaccinated?
Yeah, it has turned out to be complex why we're not at 80% vaccinated. For example, in April, when we were vaccinating 3 or 4 million people a day, predictions were that across the country we'd be at 90% vaccine coverage by now, at least in terms of adults. The fact that we stalled out a bit has been due to multiple issues, but production has not been one of those. It seems like we have plenty of vaccine to go around, but that part about going around is tricky. For example, it's hard to get vaccine to everybody. Some people live in very rural places. Some people can't leave work to get vaccines. So we have struggled getting vaccines to people. And then there have been folks who are nervous about getting vaccinated or have heard stories about the risks of vaccination that have led them to want to wait. There are others who are waiting for more formal FDA approval. I think we're seeing a lot of different reasons, and that's been part of the work that I and other people in public health have been trying to do, is meet people where they are, understand why are we struggling to get closer to 100% of eligible people vaccinated.
Is it safe to say then, sort of listening to that the issue is somewhat twofold in a really generalized way of explaining it? Part of it is the science side and wrapping our heads around that, but then there's the communications aspect and helping to communicate the safety and the efficacy of the vaccines. Is that kind of a fair way to structure what we're dealing with right now?
I really like that way of framing it, in part because so far, over 400 million doses of these vaccines have been given in the United States, and they've each been given under the watchful eye of every person who's gotten a vaccine and every person who's delivered a vaccine, and all of the complex systems that have been set up to deliver vaccines, plus the usual groups who oversee the rollout of new medications or vaccines, like the FDA or the CDC, but now we also have other watch groups. And so this has been really heavily scrutinized, and part of the benefit of that much scrutiny is we're picking up on very rare adverse events from vaccinating people, the kind of events that occur in lightning strike rarity, several cases per million doses of vaccines given. But when those sorts of events hit the news, it can be hard for people to put that type of risk into perspective. And that's an important role that we have as science communicators, to help people understand what's the risk of the disease we're trying to prevent, and what is the safety of the ways that we're trying to prevent that disease, whether that is safety of masks or safety of vaccines, and how do we put that into a way that people can really understand. Of course, also communicating about questions related to the ingredients of vaccines or the safety of the ingredients. All of these things put a lot of demand on us as scientists, physicians, public health experts to learn to better communicate to people who are scared and don't have the same access to information that we have.
Right. Well, and you alluded to some of those sort of myths or ideas that are out there that may be creating some of that hesitancy. And so, you know, for me, just to kind of address a couple of the ones that I hear out there, and particularly, you know, one is that there's a fear that the vaccine, particularly for women, might lead to fertility issues. Is there something behind that, or is there not really enough evidence, or what's the story behind that particular one?
Yeah, the intersection of the COVID vaccines and fertility came up as a myth very early in the rollout of the vaccines. And it's important to understand that there is no evidence that the vaccines that we're using adversely affect fertility, and that's true for men or women. And there is evidence that the disease itself, COVID-19, can both impact male fertility, but also be very harmful to pregnancies. So pregnant individuals are at increased risk of doing poorly with COVID-19. The vaccines have not shown any adverse effects on fertility and have shown safety in the context of both pregnancy and breastfeeding. And that's led groups like the American College of Obstetrics and Gynecology to flat out recommend vaccination for people who are either pregnant or breastfeeding.
Yeah, that's great. That's good to hear that there is safety in that particular aspect of it. One of the other pieces too, of course, is that this, you know, vaccine hesitancy and skepticism is not new. It's been an issue for years and years and years. And in linking back to some now retracted information about the link between vaccines and autism, can you speak to that one? Just again, sort of, this is a larger picture, a larger skepticism of vaccines, but I think some of that seems to be playing out in this issue as well.
Right. I mean, history really has a tendency to repeat itself, and we can go as far back as variolation against smallpox and any efforts to use the technology of vaccination and vaccines to prevent disease, and we can find people who were against those practices, despite the fact that we now have a very, very long track record of improving human health, preventing death, preventing disability, by harnessing our own immune systems to strengthen our immune systems against microbial pathogens or germs that can cause bad problems. But for every story of the development of vaccines, there has been a counter story about that these are dangerous, or that they are somehow wrapped up into a conspiracy, or that they are responsible for other ills in society. And that's been something that we as physicians and scientists and communicators have really had to battle against, and we're seeing it in full force when it comes to a global pandemic where unfortunately it's a matter of life or death.
So again, generally speaking, people are falling into two different categories now. There's a population of vaccinated, and then there's an unvaccinated population. And the Delta variant that's really emerging and becoming a lot of the big story nowadays, it's impacting both groups. Is there a differential, though, in terms of how it seems to be impacting the folks who are vaccinated versus the folks who are unvaccinated? Or is it sort of equally devastating to both populations?
Yeah, that's such a great question. I'm going to start with the easier answer, which is that the current vaccines are protecting people from getting infected by the Delta variant and other common variants out in the United States right now. The vaccines are also keeping people out of the hospital, and they're preventing deaths from COVID-19. but they're not perfect at preventing infection. They do seem to be incredibly powerful at preventing deaths and hospitalizations. But the Delta variant that's circulating seems to be better than some of the other versions of the virus we've seen in the United States at infecting people even if they're vaccinated. But I want to really emphasize an important point here, which is early in the pandemic, first of all, we were hoping for vaccines that might prevent 50% of infections, similar to how the flu shot works in many seasons. We were fortunate and had vaccines that in clinical studies of tens of thousands of people were preventing 95% of infections. And starting with that degree of effectiveness is really important when we're dealing with these variants of the virus that are more contagious and are able to get into the body of even some people who are vaccinated. It also appears that people who are vaccinated, even though they're protected from getting infection from COVID-19 or the Delta variant, if they get infected, they may still be able to spread it to other people. And that's driving some of our newer recommendations around adding masks indoors if we're vaccinated, for example. But for sure, the vaccines are doing the heavy lifting that we need them to do. If this had been a pandemic of a common cold coronavirus, and nobody was dying from it, no one was getting hospitalized, but we were told in late December of 2019 that there was a highly contagious common cold, I don't think anybody would really care that much because we face contagious colds every year. The thing we're trying to prevent are lives lost. We're trying to help people make it through this pandemic without ending up debilitated, without ending up in the hospital, without dying. And the vaccines absolutely are helping us to do that. The challenge is getting more people vaccinated so that we can continue to put the brakes on a virus that is really spreading quickly, primarily through under-vaccinated or unvaccinated populations.
Yeah, I remember reading recently that, just as a reminder, that the function of the vaccine isn't necessarily to prevent the virus from getting in. It really doesn't have that capability. It's more about containing it and dealing with it once it's in to minimize the severity of the disease course that it might run in a person's body. So yeah, it's been an interesting reminder of how vulnerable we still may be even with the vaccine. Again, talking about that vaccinated population, again, just to sort of cluster them into one group, what is the story for them? I think clearly the story for unvaccinated is, as long as they're eligible for vaccines and they have access to vaccines, it's to go get vaccinated. What's the message for the unvaccinated population? There's so much division going on in the country right now among a variety of different topics, but this is kind of exacerbating another real dichotomy there between folks that believe they follow the rules and so forth, and they're just encouraging another population to get vaccinated. And how do we create empathy for that group as well? Because they need to understand that folks who aren't vaccinated, they're people. There's a human story to that too.
Yeah, well, really, really important points. First of all, for people who have been able to get vaccines, rolling up their sleeve, going through getting one shot or in some cases 2 shots, one thing to remember if you're one of those folks is that you're protected from serious illness or death from COVID-19, and because it's harder for you to get infected, it's harder for you to play a part in spreading the infection to someone who may be more vulnerable. So the role that vaccinated people have played thus far has been incredibly important in limiting death and disability from COVID-19. If we look at hospitals across the country, the vast majority of people in those hospitals with COVID are unvaccinated, and the same is true if we look at who's dying of COVID-19. And it's important for us to appreciate that there are reasons why we've struggled to get 100% of the eligible people vaccinated, and that really requires us having empathy, extending a hand to people who are vulnerable, and trying to understand how we move them from being in the vulnerable pool to more of a protected pool. And that may mean finding better ways to get vaccines to people, or getting people to the vaccines, or having town halls with groups where uptake is low and trying to get a feel for what's on your mind. What are the things that are concerning to you? And then often it's having those one or two people in an under-vaccinated community who are able to roll up their sleeves, get their vaccine, demonstrate that it's safe, and that becomes an important leadership role that person now plays in their family or community to get other people vaccinated.
From your standpoint, I'm curious to know what can a place like the Adventure Science Center do? At the end of the day, a lot of what we're trying to do is exactly this type of thing, which is seek the source of expertise and connect that to our audience to help make sure that a good, healthy channel of communication and information is flowing. But what is the role that the Science Center can play in helping with the communication or helping people feel comfortable getting the vaccine?
Yeah, well, first of all, I'll just say the reason I'm such a huge fan of the Adventure Science Center is because of the work that the Adventure Science Center does for science literacy, really helping people of all ages understand the power of discovery and the power of science to improve our livelihood, whether that's our health or convenience or developing things like smartphones. But right now, during a crisis that's being caused by an infectious disease, there's a lot that can be taught to people about the spread of infections and how germs and microbes work. But then understanding about how vaccines are developed or how they're safe or how they're effective. This is a demonstration. The development of vaccinations, life-saving vaccinations of COVID-19, is the quintessential example of how science comes to the rescue during a global crisis. And to have groups like the Adventure Science Center always being a champion for discovery there's no better time than now. And it excites me to see the camps that you operate that are showing young children the power of science. Those young children are going to be the people that prevent the next pandemic or are there to help people in times of need through innovation and discovery. So I can't thank the Adventure Science Center enough, and I'm a proud member for a lot of those reasons.
Well, thanks. We appreciate the plug, David. One of the things that we say here a lot, and you really support that narrative through what you're saying there, is a lot of the big challenges and issues that face society, whether it's a pandemic or drought and access to food, access to clean water, clean air, they have their roots in science and technology. And so for us, I think there's an immediate way that we can help the current situation, but certainly to your point, it's very much a long play in trying to make sure that the youth of today really develop a pattern for critical thinking and understanding and valuing of science so that they can be part of those bigger solutions down the road. And yeah, hopefully we won't wind up having another pandemic quite like this again, or at least we'll have maybe a better response to it. So David, while we have you here, maybe a little bit of inside baseball. One of the things that we're curious about is right now vaccines are not available for children, typically under the age of 12. Is there a time frame when we expect that those children will have an opportunity to become vaccinated?
Yeah, that time window of when children younger than 12 years old will be able to get vaccinated has been a bit of a moving target. We're thinking that it will be late fall or early winter. It could be towards December of this year when we see these vaccines either authorized for use through emergency use authorization or formal approval. So I certainly wish the answer was yesterday, but I think we have to wait a little bit longer for more data to emerge.
Well, thanks for addressing the question about youth and being vaccinated. Sort of going back to the other side of that spectrum, we have the early adopters, the folks that were vaccinated as soon as the vaccines were available. Is there any sense or understanding that the effectiveness of that vaccine is wearing off over time and that they may be possibly immunocompromised or they may not have the same ability to fend off either the original variant or the Delta variant?
Right. That's on a lot of our minds. It's important to understand that once we get vaccinated, our immune system does have memory that will last for a really long time, but the strength of our initial immune response against an infection like SARS-CoV-2 after vaccination is strongest when our antibody levels are really peaking and appears to weaken over time. And so we're still trying to address exactly when people go from being very protected after vaccination to being more vulnerable, but we also know there are certain factors that play into that. For example, older adults tend to not have as strong of an immune response to the vaccine as younger people, and older adults have an immune response that wanes or decays more quickly. And so we're starting to see in some countries, Israel, Germany, that older adults who are among the earliest to get vaccinated are now the first in line to be getting boosters in those countries. In the United States, we haven't really formally started doing booster shots, and it's important for people to understand that the emergency use authorizations for the vaccines we're using now don't recommend boosters. Boosters are not part of the EUA, so we are using boosters outside of the guidance from FDA, and major groups like the Advisory Committee on Immunization Practices, commonly known as ACIP, or the Centers for Disease Control and Prevention, the CDC, they have not yet given us best practices or guidelines about how to use boosters, when to use them in relation to the original vaccines. I do think boosters are in our future, but we don't know exactly when and who's going to be targeted first, and if the distance in time from when you got your vaccine is going to be a major driver for those recommendations.
Okay, well, that's helpful to know. And then again, going back to the population of unvaccinated individuals, if they contract COVID, and certainly hopefully make it through that illness, how quickly can they become vaccinated on the backside of an infection?
Well, generally speaking, once somebody has had COVID, they have some protection from getting reinfected, particularly by the same variant that caused their original infection. And that protection may last for several months. We are seeing people who got infected with the original COVID SARS-CoV-2 strain who are now getting infected again with the Delta variant, which is one reason why we've really been emphasizing for people who have recovered from infection to get vaccinated. We don't think you can be too immune to SARS-CoV-2, and the question is timing. Once somebody has fully recovered from their COVID-19 illness, they can get vaccinated. Some people are choosing to wait 2 or 3 months after they've recovered from symptomatic COVID to start on their vaccine schedule, and that's perfectly acceptable too. But if someone's anxious and wants to get vaccinated and they've fully recovered from their initial symptomatic illness, they can absolutely get vaccinated. And if someone was diagnosed with COVID and they never had symptoms, or their symptoms were really trivially mild, it's important for them to get vaccinated because their immune response to infection may have been similarly very mild, and they can go ahead and get vaccinated.
Well, that's hugely important to hear. I know that there's a number of folks in the population who have had COVID who believe that that's what has given them sort of this prolonged immunity to either subsequent variants or even the original strain that is still circulating out there. But it sounds like really the advice for them is get vaccinated anyway. You certainly can't be too protected. So.
That's right. Natural infection will confer some protection, but it's different almost with every person. The advantage of the vaccines is that they strategically help train your immune response on one very important part of the virus, the spike protein on the virus. That's the Velcro that the virus uses to stick to our cells and set up shop and cause infection. And the vaccines train our body to block that protein and make it so the virus really struggles to set up an infection in our body. And adding that degree of surgical specificity to someone's immune response, even when they've recovered from COVID, is a fantastic way to try to keep people safe.
So one other quick question for you is just, in all of this, it's been, I'm sure, a very, very difficult year and a half and so forth for you to have been going through this on the front lines, seeing it from so many different angles. But what's the good news? What's the good story in terms of where we are right now? Because I think sometimes it's easy to get discouraged with everything that's happening, but what's the light that's there for us to kind of hold on to?
Yeah, well, I think in all this tragedy of really, in the United States, hundreds of thousands of lives lost through COVID-19, we are seeing some silver linings in this situation. Some of it has been around science communication and getting information to people, having more people understand the important role that medicine and science can play in improving public health. We're also seeing the power of vaccines working. We're developing new medications to help prevent the onset of COVID-19 or to treat people who are suffering from COVID-19. And that, I think, has been a really powerful reminder that our investments in science, our investments in discovery, might not immediately seem to have a reward at the end of that study or the scientist or group that we're funding to do research. But when you need science the most, all of a sudden the people who understand how the world works by engaging in the scientific method can come together and say, here's the problem, here are some solutions, and we're seeing that play out during the pandemic. I'll also just end that answer by saying, I've seen so much love and care from people of all different walks of life for each other, and in a time of crisis, to see groups from different corners of our community and our planet coming together to help one another is just a reminder of how lucky we are to be alive, honestly.
Yeah, well, that's a great answer. And the last time that you were here, I asked you what was the one thing that you're looking forward to, kind of hopefully post-pandemic. We're not obviously completely out of the woods yet, although we've had some opportunities to resume some aspects of normal life. And yours was live music, getting to go see some live music. Have you had a chance to do that yet?
I have not, except on television or through the internet. So I'm still really looking forward to going to see some live music. I got in a little bit of trouble for that answer by not saying that I wanted to go see my mom. So I do want to go see my mom too. She lives way out on the West Coast.
Can your mom play music? Is it like
that would be the
combine
best.
The two together?
Yeah, she certainly tried to help me play piano when I was a kid. But honestly, so many of the things that we want to get back to are just around the corner, and unfortunately they've been that way for several months. And I'm hoping that as more people get vaccinated, that we're able to head back to doing the things that we love.
Yeah, I'm hopeful that we get there pretty quickly too. Last parting thought, if there's anything that you want to make sure it gets out in terms of the message today, what is that, the perspective from Dr. David Aronoff? I want to make sure that everybody hears this message.
Yeah, thanks. First and foremost, the virus that we're up against, we've learned a lot about over the past 18 months. We know how it spreads, and we know how to limit risk to people. And now is a time where there are two things that we really need to do. One is, if we're eligible to get immunized, we really need to get vaccinated. And the second thing is to pay close attention to what our public health experts are saying that we need to do to limit risk even beyond getting vaccinated. And that may mean continuing to pay attention to the distance between ourselves and other people, wearing a mask in certain situations where we may have recently gotten used to not doing that. But just like if we're on a beach and the lifeguards are telling us to come in closer to the edge of the beach and away from the deep part of the ocean or the water, we need to be paying attention to our public health experts right now and listening to what they're asking of us, and be willing to do that to get out from underneath this pandemic. So vaccination, paying close attention to what the experts in our communities are asking of us to limit the spread of COVID-19, and we'll get there.
Great. Well, David, thanks for coming again, and maybe the next time we have you back, it'll be a better story, and hopefully this thing will be in our rearview mirror. You'll have had a chance to go visit your mom and see some music. But thank you again for coming and helping to share your expertise with us. We really appreciate it.
Steve, thank you so much. It's been an honor.